With more than $1 billion in building and service upgrades underway, the Illawarra Shoalhaven Local Health District has continued to progress our most ambitious capital works program over the past 12 months. Starting in the Shoalhaven, the hospital's new acute services building achieved a major construction milestone, reaching its highest point. Hospital staff and community members tied messages of thanks and goodwill to a tree before it was hoisted to the top of the building, honouring a construction tradition known as a topping out ceremony. Back on the ground, the redevelopment crew worked with hospital teams to start the planning and preparation for the mammoth task of transitioning to the new facility. Prototype rooms giving a sense of the look and feel of their new space. Engagement sessions continued, providing project updates for staff and the community who were just as keen to hear about the construction progress. The all-important cafe and retail space on the ground floor was put out to tender, while the Arts in Health program kicked off, starting the process of creating a healing environment by integrating art and health. The first artist commissioned this year was Curly Saunders, whose culturally significant designs were shaped by input from local Aboriginal community groups. Lara Merritt was also selected. She worked with local residents, staff and mental health consumers to co-create bespoke pieces for the hospital's new mental health courtyard. By June, the rooftop helipad and building facade had emerged, including signage revealing a new name, Shoalhaven Memorial Hospital, paying tribute to the facility's history while upholding contemporary hospital naming conventions. In August, the second tower crane was removed from the site after the final concrete pour. As spring rolled around, the project team created an environmental community connection with dozens of seedlings given out at the Nowra NAIDOC event, showcasing the landscaping plants that will be used to green the hospital grounds. In October, as the scaffolding continued to be removed, construction started on the link bridge between the old and new buildings. Work now continues at a cracking pace to complete the interior fit-out. Over at the new Shellharbour Hospital site, work kicked off at pace with the arrival of the first crane in March, quickly followed by a second in May, both standing ready to do the heaviest of lifting to bring our newest hospital off the ground. To celebrate the arrival of the cranes, local school children took part in a competition to create a moniker for the lifters. More than 130 entries were received, with Shane and Anita Lift the winning entries. By June, the first major concrete pour was complete, laying the foundations for the hospital's perioperative unit, featuring advanced operating theatres. This will help to position Shellharbour as the region's dedicated centre for general elective surgery. In August, the community got a sense of the size and scope of the facility, with new images starting to bring the vision to life. The new Warrawong Community Health Centre kicked off as part of the wider Shellharbour Hospital and Integrated Services project, with an official sod turn held in May. This project will deliver important community-based services, including Binji and Buri, kids and families clinics, counselling services and other specialised care in modern and user-friendly spaces. At Wollongong Hospital, a package of upgrades commenced in April. This $21.9 million series of works includes a new medical imaging department with an additional MRI and CT scanner machines, and the relocation and expansion of the hospital's medical ambulatory care unit, whilst a new transit lounge provides an area where patients can wait comfortably before being discharged or transferred to another ward or facility. In September, Wollongong received its brand new MRI machine with much fanfare, as a 650-tonne crane lifted the impressive equipment over the top of the 10-storey hospital and into its new home. Works also commenced on the expansion of the emergency short stay area, a key component of the hospital's emergency department. This is a designated ward within the ED itself, specifically designed to care for patients with less serious conditions. October saw the start of $7.5 million worth of upgrades at Milton Ulladulla Hospital, including at the Community Cancer Services Centre. In addition, the hospital will receive a new CT scanner, giving the community greater access to local diagnostic services. This year's progress on our transformative infrastructure projects continues to develop the footprint of the Illawarra Shoalhaven Local Health District. Most importantly, it advances our capacity to care for our growing communities and brings to life our vision of excellent services, quality partnerships, and healthy communities.